Conversations on AIDS.gov.
Today, I am talking with Reverend Edwin Sanders about the role of faith leaders can play in supporting the National HIV/AIDS strategy and fighting stigma. Reverend Sanders is a senior servant of the Metropolitan Interdenominational Church in Nashville, Tennessee. The church has been active in responding to HIV/AIDS for over 25 years. As you know, Reverend Sanders, National Black HIV/AIDS Awareness Day is February 7th, and one of many opportunities to reach the community. One of the goals of the National HIV/AIDS strategy is to raise awareness of HIV/AIDS in communities, particularly communities that are most impacted. In your view, what can faith communities do to support the goals of the National HIV/AIDS strategy?
Thank you, James. One of the things I think is most important for us is to appreciate the fact that the strategy does give us a clear roadmap and a clear blueprint that allows us to be able to collectively understand the ways in which we can most effectively work together. The first thing I would say is that we have to appreciate the fact that we do have the opportunity to address more people within our communities on a regular basis than really anyone else. I think the other thing that we have to do is to realize that the opportunity to work in partnership with each other is something that is extremely significant, because we have to become appreciative of the fact that the more things that we can do collaboratively, the more things that we can do together, the more effective we can be within the faith community.
Thanks. Can you give some specific examples of how faith communities are using the National HIV/AIDS strategy to support their HIV-related work so others might learn from their experience?
I think in our church, one of the things that we've done over time is that we have seen the avenues to start with education, to move then to provide some prevention messages, then become involved in delivering direct services. Now, for us as a congregation, we've evolved to the point where we also have a primary care clinic. Everybody doesn't have to have a primary care clinic, but it is important for us to get to where the point where people understand that these kinds of services are within the scope of what's possible, so that we do those things. But there are other churches in this country who do important and effective work as well. I think about Houston, Texas. I think about Brentwood Baptist Church there in Houston. Pastor Joe Ratliff has been doing this ministry for many years in a way of information dissemination, prevention work, and the like. If you go to Atlanta, Georgia, it's clear that there, especially in examples with Raphael Warnock, who is one of the faith leaders in that community. He's at Ebenezer Baptist Church, the King Family Church. They are an important place in that regard. You could take a walk around the country, and I can continue to call names of people who do different things. The other thing that's so important, which I think is complementary to the strategy, is that the church ends up being a very important partner to the biomedical community, and making sure that somehow that line that too often is drawn between science and theology does not end up being a problem, as far as us not having the kinds of relationships and the kind of rapport with each other that allow the issues of distrust and fear, which very often get in the way of people who are in our communities being willing to get involved in vaccine trials and other kinds of research initiatives that are very important for us and bringing about a day when this disease comes to an end.
Thanks. AIDS 2012, the International AIDS Conference, will be in Washington, D.C. this summer. You have been working with other faith leaders on activities related to the conference. Can you tell us a little bit about what's happening in that environment?
I think that this is going to be an important opportunity for us in the United States to work with faith leaders from around the world in a way that allows us to cut across, especially faith traditions, in a way that too often does not occur. The things that divide us are nowhere near as great as the things that we have to be united around. And what we're trying to do is make sure that we keep seeking that common ground such that we're able to work together. So that's one thing.
Thanks for talking to me today, Reverend Sanders. For more information on U.S. government partnership with faith communities in response to HIV/AIDS, please visit the webpage for the White House Office of Faith-Based and Neighborhood Partnerships. For more information on HIV prevention, testing, and treatment, please visit AIDS.gov. Thanks for watching.